Multiple sclerosis is a neurology exam question that usually is designed to separate the elite medical student from the regular medical student or the regular young doctor. So in this video, I will teach you everything you need to know to be comfortable in answering multiple sclerosis exam questions on the USMLE or other medical exams. My name is Abdul Hadi. I'm an internal medicine hospitalist, and let's go to the board. Here's multiple sclerosis. Usually, the question will start with a patient who is a female, and it's between 20 to 40-year-old. So it's always very important to get that clue from the get-go, and they will tell you about a presentation that is subacute. It's not something that happened today, it's not something that happened yesterday, but the symptoms takes days or weeks. The presentation is subacute. And also, in multiple sclerosis questions, look for this time and space. What do I mean by time and space? This means the symptoms were present at 2 different times. They say separated by 30 days. So they will give you like symptoms that happened 3 months ago and symptoms that happens now. And they're also separated by space. So what I mean by space is they are at a different location in the central nervous system. They happen at 2 different times, and they happen at 2 different locations in the central nervous system or more. So here I made a drawing of the locations that we commonly see involving multiple sclerosis at presentation. So you have the optic nerves, and you have this onion-shaped structure, the cerebellum, and you have the brainstem, and you have the spinal cord. These are the locations that will be involved. So how does the optic neuritis involvement present in multiple sclerosis? Is usually one eye, decreased vision associated with pain with the movement of the eye. That is very important, and they will tell you that the afferent pupillary reflex is impaired. This is what you need to know about optic neuritis, and focus on this: pain with movement of the eye. And then what do you expect if the location of the space is in the brainstem? Then you expect, for example, cranial nerve lesions, cranial nerve abnormalities like vertigo, double vision, or facial asymmetry. What do you expect from multiple sclerosis involving the cerebellum? You will be expecting gait imbalance, tremors, ataxia. What do you expect if it's involving the spinal cord? You expect weakness on one side, numbness on one side, and you have this sign that if you see on the exam, it's a telltale sign. It's a Lermiter sign, which means if the multiple sclerosis lesion involving the cervical spinal cord and you flex the neck of the patient, or the patient flexes their neck, there will be a shooting pain down their spine to their legs. That's called the Lermiter sign. So they will give you a presentation that is subacute and at 2 different times, separated by 30 days and separated by space within the central nervous system. So they'll give you this and this, or they'll give you this and this. And they will then throw distractors at you. Like the most important distractor, I feel like, it's stroke. And stroke is usually, you can tell because the patient is older and the presentation is way more acute. They can also throw a distractor like infection. And infection, usually there is with it like neck rigidity or a fever and things that are not, that pointing that there is an infection going in the system. So then they will either ask you what is the most likely diagnosis and throw a bunch of distractors, and one of them is multiple sclerosis. And because you watched this video and you are now armed with all this information, it will be easy and comfortable for you to choose a diagnosis. If they ask you what is the diagnostic imaging modality that you would choose, you say, I want MRI of the brain and the spinal cord with and without contrast. And you also, if it's first presentation, you do a lumbar puncture and you send the cerebrospinal fluid, and you want to be looking for oligoclonal bands. If they ask you about the treatment, although this video is not for the treatment, but it's usually a treatment for exacerbation, and that's a straightforward steroid. But I want you to know how to formulate your diagnosis of multiple sclerosis, because it's usually a tough question on the exam. If you like this video, please hit the like and follow me and share it with your friends. Thank you so much.